All right, everyone, ready to dive deep. Today, we're tackling something pretty interesting. Lockjaw.
Ooh, lockjaw.
Yeah, and I think it's safe to say most people, when they hear lockjaw, they think one thing.
Tetanus.
Exactly, rusty nails and all that. But we're going way beyond those childhood warnings today. We're going to unlock some serious knowledge about lockjaw, stuff you probably haven't even thought about.
It's more than just tetanus, that's for sure.
Way more. So to kick things off, what exactly is lockjaw? It's not just having a stiff jaw, right? There's got to be more to it.
You're right. It's more than just a stiff jaw. We call it trismus. Basically, it's all about those muscles in your jaw, the ones you use every time you open and close your mouth. When those muscles go into spasms, you've got lockjaw.
So basically like a Charlie horse, but in your jaw.
Exactly. And trust me, it's not a pleasant experience.
I bet. And I'm guessing it can be caused by a lot more than just stepping on a rusty nail.
You're absolutely right. We're talking a whole spectrum of causes, some as simple as, a misaligned jaw.
Really? Just from that?
Oh, yeah. But then it goes to things that are a bit more concerning. And the important thing is, while lockjaw can be temporary, if you ignore it, it could turn into a long-term problem.
Okay, now I'm really listening. So tetanus, it's the obvious place to start, right? I mean, those warnings about rusty nails are drilled into us from childhood. But how common is tetanus as a lockjaw cause these days?
You bring up a good point. Tetanus is nothing to mess around with. It's a serious bacterial infection.
Mm.
And it lives in soil, dust, manure, all those places you don't want to think about too much.
And it can get in through the tiniest cut, right?
Exactly. Even a little scratch. And yeah, it can be fatal in some cases. But to answer your question, thankfully, thanks to vaccinations, tetanus is pretty rare, especially in developed countries.
That is good to hear. But it's definitely a good reminder for everybody out there. Check your vaccination records, make sure you're up to date.
Can't emphasize that enough. Those tetanus boosters are important for a reason.
Absolutely. Okay, so tetanus, it's serious, but it's not the only culprit when it comes to lockjaw. What else should we be aware of?
Let's dive into some of the lesser-known causes. We can break it down into categories. First up, problems with your jaw itself, specifically that temporomandibular joint,
The TMJ.
the one and only. Ever heard of temporomandibular joint disorders, or TMD?
Vaguely. It rings a bell like a jaw problem,
Uh,
right?
But how common are we talking? Way more common than you'd think. Millions of people have it. Think about it. You have these joints on either side of your jaw, connecting your jawbone to your skull. When those joints aren't working right, you've got TMD.
Wow. Millions. I had no idea.
Yeah.
So that's jaw and joint issues. What's next on our lockjaw list?
Okay, so TMD, it's a much bigger deal than a lot of us realize. What else can cause these jaw issues?
Well, infections can definitely be a factor.
Oh, really? Like what?
Well, the obvious one, infections in your mouth. Things like tooth abscesses, those are a common culprit.
That makes sense. I mean, infections right there in the jaw can't be good.
No, not at all. But it's not just limited to your teeth. Think tonsillitis or even something like meningitis. Those can actually cause lockjaw too.
Meningitis. Wow, I never would have thought of that. Yeah, it just goes to show seemingly unrelated illnesses, they can have these surprising side effects. It's all connected.
That's for sure. All right, so we've got jaw and joint issues, infections. What else?
Well, some people are unfortunately predisposed to lockjaw from birth.
Oh, really?
Yeah, congenital conditions, we call them. And then there's cancer, tumors in the jaw, head, or neck. Those can all lead to lockjaw as they grow.
That's scary. I can't imagine having to deal with that on top of everything else.
Absolutely. It's a serious issue and definitely not something to ignore. And speaking of serious, we've got inflammation.
Okay, inflammation. I mean, it's joints get inflamed, right?
Exactly. Think of it like arthritis in your knee, but in your jaw. You can get arthritis in your jaw joint, or even conditions like TMJ ankylosis.
TMJ what now?
Ankylosis. It's a mouthful, I know, but basically what it means is the joint, it starts stiffening up, sometimes to the point where the bones actually fuse together.
So your jaw's just stuck.
Pretty much.
Yeah.
Imagine your jaw basically frozen in place. Not fun.
I bet. You definitely need to see a doctor for that. Okay, so we've got jaw issues, infections, congenital conditions, cancer, inflammation. Anything else? Or are we done with this laundry list?
Well, this next one might surprise you. Even your own medications can cause lockjaw.
Wait, really? So you're telling me my daily multivitamin is going to give me lockjaw?
Not quite. It's more about certain types of medication like antidepressants, antipsychotics, even radiotherapy for cancer treatment. Those can sometimes have lockjaw as a side effect.
Huh, the things you learn. So if you start getting that stiff jaw, it's probably worth checking with your doctor about your meds, huh?
Exactly. It's all connected, like we said. And of course, we can't forget about good old-fashioned trauma.
Ah, right, like if you get whacked in the jaw playing basketball or something.
Exactly. Any kind of injury like a fracture or dislocation, even complications from dental work.
So basically, anything from a rogue elbow to a wisdom tooth extraction gone wrong.
Pretty much. It's a surprisingly long list when you really start thinking about it.
That is a lot. So, okay, we know now that lockjaw is way more than just a tetanus risk. It can be caused by a whole bunch of things. But what happens when it actually strikes? Like, you wake up one morning, your jaw feels stiff, maybe some pain when you try to open it wide. What do? Are there things you can do at home for relief?
You know, a lot of times, those old tried and true methods can really do wonders.
You mean like heat and cold therapy?
Exactly. Just like if you had sore muscles, alternate between warm and cold compresses on your jaw for about 15 minutes at a time.
And I'm assuming over-the-counter pain relievers like ibuprofen, those could help too?
Absolutely. They can help with the inflammation and the pain. And gentle massage, that can be really helpful. Just gently rubbing the muscles around your jaw right near your ears.
Okay, good to know. What about stretching? Is that a good idea?
It can be.
Gotcha.
Gently opening and closing your mouth, moving your jaw from side to side, those can all help. But always listen to your body. If it hurts, stop.
Good advice. I'm definitely someone who tends to try and push through pain thinking it'll help, but I'm guessing that's not the best approach here.
You got it. You want to relieve the tension, not make it worse. And here's another thing that might surprise you. Your posture can actually play a role in jaw pain.
Really? How so?
Well, think about it. If you're hunched over a computer all day, your neck and shoulder muscles, they get tense. And that tension, it can radiate all the way up to your jaw.
Huh, who knew? So basically, good posture, staying hydrated, those are all things that are good in general, but they can also help if lockjaw strikes.
You got it. Prevention and treatment, 2 birds, 1 stone.
I like it. So we've got heat, cold, pain relievers, massage, gentle stretching, watching our posture, staying hydrated. That's a pretty good list. But at what point do you say, okay, this is beyond my at-home spa treatment, I need to see a doctor?
Yes, the million-dollar question. And it's an important one, so let's talk about those red flags.
Red flags, got it. So what are we talking about here? When is it time to pick up the phone and get some professional help for your jaw?
Well, if you even think it might be tetanus, like you've got a deep wound, it's been exposed to dirt, especially rusty metal, and then your jaw starts acting up.
Don't mess around.
Exactly. Go straight to the doctor. Don't wait on that one.
Okay, good to know. But what about for the other lockjaw causes? What should we be watching out for?
If the pain is really bad, or if it comes on suddenly, those are big ones. And definitely anytime you have lockjaw with a fever, call your doctor right away.
And I'm guessing if you've been trying those home remedies we talked about, the heat, the massage, all that, and nothing's helping, that's a sign you need to call on the pros, right?
You got it. If it's been a few days, you're doing everything right, and those symptoms are sticking around. Time to make an appointment. You want to rule out anything serious and get the right treatment. Early intervention is key.
Absolutely. So we've talked about what to do when lockjaw strikes, but is there anything we can do to prevent it in the first place? Keep our jaws happy and healthy.
Absolutely. Staying up to date on those tetanus boosters is huge.
Check. But what about things like TMD? Can we do anything to prevent that?
You absolutely can. A lot of it comes down to being mindful of your jaw habits. Like we said, good posture can make a huge difference.
Right. That hunched over computer posture is a killer.
It really is. Also, try to avoid grinding your teeth.
I've got a friend who wears a mouth guard at night for that very reason.
Those mouth guards can be lifesavers. Seriously.
Yeah.
And even just those little habits you might not realize you have, like chewing on pens, biting your fingernails.
Oh, man, I am so guilty of the pen chewing.
It's more common than you think. But really, it all comes down to being aware of your jaw. Even when you're just relaxing, is your jaw relaxed too? Or are you clenching your teeth without realizing it?
It's amazing how much we do subconsciously, right? The tension in our shoulders, clenching our jaw.
It's incredible the things our bodies do without us even realizing it. And of course, this is all general advice. If you've had any kind of oral surgery, radiation, anything like that, following your doctor's instructions is crucial.
Absolutely. So to wrap things up for our listeners today, I think the big takeaway is that lockjaw, it might be common, it's often temporary, but it's definitely not something to ignore.
Exactly. It's your body's way of telling you something's up. Whether it's a minor issue or something more serious, it's a sign to pay attention. And as we've learned today, knowledge is power.
So true. We've covered the causes of lockjaw, the symptoms, potential treatments, and most importantly, ways to prevent it in the first place. We've given you all a lot to think about, a lot to chew on.
I'll see myself out.
But before we go, one final thought. We've talked a lot about external factors today, but what about the internal ones?
Oh, I like where you're going with this.
Things like stress and anxiety, we all experience them, but they often manifest physically. And you know what? The jaw, it's a prime target.
It's all connected. Your physical and mental states, they're in constant communication.
Exactly. So as you go about your day, pay attention to your jaw. Are you clenching? Are you holding tension there? And if so, what's going on in your mind at that moment? Maybe that awareness can unlock something valuable, not just about your jaw, but about yourself.
Now that is something to chew on.
I thought you might like that one. Who knew Lockjaw could be such a fascinating deep dive? Thanks for joining us, everyone. Until next time, stay curious.